Everybody has heard of the ability to control one's dreams. With movies like Inception and Shark Boy and Lava Girl, how could you not? But you can't actually control your dreams the way people think you can. Shark Boy and Lava Girl gives the impression that you can become more creative by being able to control your dreams. That's a myth. It's not true. What can happen, though, is you can use your dreams to fight something else. Many scientists believe there is a link between lucid dreaming and curing PTSD. Hi, my name is Tyler Clayton, and I will further explore the possibility of curing PTSD through lucid dreaming. The term lucid dreaming refers to when one is dreaming and the ability to control that dream, but it is more complicated than most people know. Lucid dreaming occurs because of rapid eye movement, or REM for short. REM is invoked through sudden activity in the cardiovascular system, respiratory system, and neurological system. In the neurological system, the prefrontal cortex, the frontal part of the brain, experiences activity that normally isn't present in a typical sleep. It has been further identified that lucid dreams can be stimulated as a result of increased specific activity in the lower gamma band, which is also in the prefrontal cortex. The lower gamma band is part of the brain that are responsible for sensory preconceptions. For simplicity, we will say it is the reason that some dreams seem so real. When 40 Hz of gamma energy is present in the lower gamma band, there is a higher probability of lucid dreaming. Scientists believe that this could be used to combat PTSD, but this was proven invalid. This conclusion came from an experiment by Spookmaker and Van de Bout. The scientists attempted to directly treat PTSD through lucid dreams, but they failed. There were also too many confounding variables, like lack of lucid dreams and lack of nightmare brought on through PTSD, to have a solid base for conclusion. This failure opened the door for another idea of curing PTS nightmares with lucid dreams. This type of treatment is called lucid dreaming treatment. Another scientist named Dr. Robert Phil further explored this possibility in an experiment. The experiment had 5 subjects who all reported that they suffered from traumatic nightmares, a common side effect of PTSD. Some of the patients had been experiencing nightmares for a couple days, while others had experienced them for a couple months. The experiment found that all 5 were positively affected by lucid dreams, with 4 out of 5 reporting they had never experienced lucid dreams since the experiment 1 year later. It found that lucid dreams could in fact be used to treat traumatic nightmares. A psychiatric therapist named Dr. Thomas Green firmly believes in this theory. He advises any patient who has nightmares to confront the nightmare while it is occurring. He tells his patients to say, "This is a dream," while having that nightmare. The idea is that by confronting the nightmare while it is occurring, the dreamer can take control and turn it into a lucid dream, thereby changing the outcome. This is precisely what happened to a patient of Dr. Green's. She confronted her dog nightmare and turned the dogs that were chasing her into hot dogs and then ate them. The girl later told Dr. Green that she had never had the nightmare again. Another example of traumatic nightmares being treated as a result of lucid dreaming. Another way to use lucid dreaming as a way to confront PTSD is to give the feelings involved in PTSD a form. Jared Zeisel, author of Field Guide to Lucid Dreaming, uses his lucid dreams to create a negative persona of himself. He then telepathically converses with the persona in the dream. Zeisel admits that it sometimes gets scary talking with his quote-unquote demons, but by being able to stand up to his demons in his dreams, he feels he can stand up to them in the real world. Although this technique requires much more practice than the average lucid dream, it could prove to be more effective than turning a nightmare into a lucid dream. In conclusion, although lucid dream can't be used to directly treat PTSD, it can be used to treat the side effects. Post-traumatic nightmares are a key aspect of PTSD, and these nightmares can be treated through lucid dreaming treatment. By being able to alter one's nightmares, the dreamer can change the nightmare to a lucid dream, which means that the person now consciously control what is happening while dreaming. By confronting the nightmare, it is believed that the nightmare will never happen again. This allows lucid dreaming to be a remedy of traumatic nightmares and a stepping stone to the path to treating PTSD. Thank you.